stuff.
It's time for the quick and dirty medical tip.
You're not. You know, I've said it wrong the whole time.
Have you?
You are not, but you are prepared.
Yeah.
That's what I should have been saying. Quick and dirty.
All right.
So facial lacerations are always tricky. You know, you don't want a scar.
Yeah.
Can I use glue? Can I staple their face together?
Elmer's glue.
Yeah. So it's a little bit of a tricky, like, it's always hard to determine whether or not I should stitch something on the face or if glue is going to work. So it's more or less like, when can you use adhesive for wound repair?
Yeah, sure.
So I know I've talked about it before, but a lot of people have adhesive, you know, a super glue that can be used. This is when you can and can't use it. Here's some of the advantages to using glue over sutures. The maximum bonding strength at 2 and 1.5 minutes, like you can get something closed immediately. It's equivalent in strength to healed tissue at 7 days post-repair. Can be applied using only topical anesthetic. You don't need to numb.
That's the nice thing.
You don't need to use needles. Faster repair time. Better acceptance by patients. Obviously, people want to be glued rather than sutured.
Yeah, please don't suture me if I don't have to be.
Right. Water-resistant covering. So that's another benefit. It's almost like a bandage.
Yeah.
You know, you're swole up real nice.
Yeah, it looked awesome.
Yeah. And it doesn't require the removal. So once you get them done, you just wait for it to kind of fall off and voila.
That's good stuff.
So there are contraindications. There are times when you can't use adhesives no matter where it's at. Here's a few of them. Jagged or stellate lacerations, you know, like half moon shaped or like triangular. You can't, if you can't bring the edges together smoothly, don't bother with a glue. If it's all you have, use it. But bites, puncture wounds, or crush wounds, don't glue those shut.
Jeez.
Like if you get bit in the face,
you
don't want to close it because it get infected. Contaminated wounds, obviously. If it's not clean, don't close it up. You want the body to.
That's what she's
take
saying.
care. Mucosal surfaces, so like your lips, anywhere that like secretes that's moist.
Yeah.
Like you don't want to put glue in there. 1, it's not going to stay. 2, it's not going to stay. Okay.
3, it won't stay.
If it's in your armpit or in your perineum or taint area or
gets a cut
in the
there?
genital.
Like, what happened?
Now, big poop maybe tear your butthole.
Good gracious! Take
or
a picture.
Somebody, yeah. Those high moisture areas, obviously, the glue's not going to stick. They just don't heal well with glue. You need to suture them. Hands, if it's on the back of the hand, you could probably get away with it. But fingers and joints.
Hey, you super glue my finger?
Yeah. But like if it's on the surface, like the palmar side, that it's just not going to do very well because of sweat and all that.
I get you.
You should consider a stitch. One thing with fingers and stuff, you get a laceration if you decide to glue it, splint it, you know, that'll just keep it from falling off. And then the other thing is like if it is a laceration on the face, if it goes into the eyebrow, because if you glue it, you don't get the good approximation. It's probably better to suture it.
Because you don't want it to end up looking
if it goes through your lip or it's through and through, you don't want to glue it. And then if it's bigger, I think they say 2 centimeters. I can't remember the actual.
Like in length?
Yeah, if it's a big old long sucker, because you know you got a lot of tension on your scalp and on your forehead, and the bigger it gets, the more it wants to spread open.
Because I glued my daughter's, and hers was about yay long. Probably.
Yeah, you can get away with about.
But it was like right on her hairline.
I'm trying to think the exact. Anyways, if it's big and long and really weird looking, definitely don't suture.
That's what she said.
Set myself up there.
You didn't you not?
But yeah, glue is great for kids and it works really well.
Yeah, man.
But if it crosses through the hair and you want to, you know, cosmetically keep the hairline like lined up and stuff like that, you probably should use sutures. And then if it goes into the lip, you don't want to do it there.
Yeah,
and
my daughter had
huge and long. You don't.
My daughter got bit on the lip.
Yeah,
by
that
a
one
dog,
was kind of rough.
and so she had to get stitches right there.
Yeah, but yeah,
it doesn't
use
look
glue.
too bad though.
There's just those things you don't want to use it on.
Dude, you gotta have super glue in your first aid kits.
Yeah.
It's just so useful.
If it's all you have, you'll be super glad that's all.
Yeah,
because
super glad for the super.
Because even if it falls outside of these things, like if it is a little jagged or it's, I mean, if you have something to close it, better than nothing.
I agree.